What is the best treatment for hormonal urinary incontinence in dogs? That's the question today. This question is about the different types of medication that we use, and generally speaking there are two different types. Which is the best one? How do we decide which is the best one for your dog, and which one do I recommend? Well, we've got a couple of different medications. One's called propylene and one is an estrogen kind of supplement. Now both these medications work well and are generally considered safe to give, although as with all medications there is the potential for side effects, but in my experience these are really very rare. So propylene can cause restlessness, it can cause aggression, irritability and even high blood pressure, and then estrogen treatment has the potential to be toxic to the bone marrow. Now as for which one I recommend, I tend to recommend propylene. It's my personal preference, it's very much a personal preference, and the reason I recommend that to start with is for a couple of reasons. So although the side effects of either of these are very, very rare, I feel that bone marrow problems are probably more severe, and they have a greater potential to even be life-threatening. Although, like I say, if your dog is on an estrogen supplement for this, the chances of that is very uncommon, and ideally we'd be monitoring for that as well with blood tests. But the other benefit for propylene is that it comes in a liquid formulation rather than a tablet, and that means that the dose can more easily be tapered to the lowest effective dose, and that's frequently a lot lower than the starting dose tends to be. So that's my reasons for choosing propylene, but it may be that in your dog that a different one, the estrogen treatment, is more appropriate, or you'll find it easier to administer. So really, kind of in reality, it probably makes very little difference which you choose if they're both suitable for your dog, given their other kind of medical history and any other concerns that they're suffering with. And then if one fails to work as expected, I would have no concerns about switching to the other drug in the majority of dogs.